Hello, I am Dr. Prabodh Karnik. I am the pediatric ENT surgeon at the SRCC Children's Hospital managed by Narayana Health, and this is at Haji Ali in Mumbai. Well, we see a lot of children who have inserted objects, small objects, into their ears and their noses, and very often we get frantic calls from the parents as to what one should do. If a child has inserted a small object into the ear, the first thing that one should do is not to panic. And if the child is started crying or is panicking a lot, should quieten the child down, perhaps give even a little bit of a painkiller or something like that, and then see what is wrong with the child. If the foreign body, very often it's a sponge or a bit of a thermocol or sometimes a bead also, if one can see it, and if the child is cooperative, it could be removed with a small tweezer that one uses for, let's say, tweezing out the eyelashes or the eyebrows. But more often than not, it's often not possible, because the foreign body has travelled deeper inside the ear canal. And when the child is brought to us in the hospital, it's often that the child is crying. The child has had one or two unsuccessful attempts at removal by the doctor or by the general practitioner or a well-meaning family member, and there is a swelling and some amount of blood that is there. What I would do is examine this child, know what the foreign body is, and if it is possible, if the swelling is not much, I have special instruments in removing it. Sometimes I have to use a water-based syringe or even a suction machine to remove that foreign body out. Sometimes it so happens that a live insect, sometimes a cockroach or a beetle or an ant, enters the ear. And this especially happens in a rural or a semi-urban setting, and often the child gets up crying, wailing out in pain. This is the time to put a little bit of warm oil into the child's ear, drown that insect and make it dead. And if it's possible, try to syringe out that ear or wash that ear with a little bit of the burst from a shower. Then let the foreign body come out. If it doesn't happen, I think one must see the doctor, who will assist you in removing it. Well, foreign bodies inserted into the nose, again, are usually peanuts or nuts of any kind, sometimes beads, pieces of chalk or pieces of foam, and the worst or the most lethal foreign body are button cells or AAA cells that are relatively small, and in a moment of curiosity, the child inserts this into the nose. If it's so long as it's not a button cell or a sharp object, number one thing is not to panic. It's very rare that a foreign body from the nose ever travels into the windpipe or creates problems or complications. It's best that you see the ENT doctor as early as possible, and the ENT doctor will then, with special instruments in a cooperative child, be able to remove it about 9 out of 10 times. Infrequently, if the child is very strong, if the child is resisting removal, or if the foreign body is deep inside and cannot be seen, then the doctor may advise you for some X-rays, perhaps even a CT scan, and then take the child to the operation room where with a short burst of full general anesthesia, the foreign body can be removed with special instruments including an endoscope. A button cell or a AA or a AAA cell is really very dangerous, because once they go into the nose, they can start discharging and destroy the inner lining of the nose and cause permanent complications and problems in the child. These foreign bodies need very early removal, even perhaps late at night or early in the morning, or whenever the person is ready, or the parents have realized that the foreign body is in the nose, and these must be removed as early as possible. It so happens sometimes that the child has put a foreign body inside the nose, and either the parents are unaware of it, or they feel that it has been removed, or it has fallen off, or something of that kind. In such situations, it so happens that after a few weeks or sometimes months, and very rarely years, the foreign body gets infected. It develops a mucoid or some kind of a thick lining around itself, and it starts eroding the nasal inner lining. These children present to the doctor with a one-sided discharge from the nose, which is blood tinged. The discharge is blood tinged, it is foul smelling, and it is sticky. And it is a dictum that in a child below the age of 5 or 6, a one-sided blood tinged discharge is almost always a foreign body that has been forgotten. These situations will have to be dealt with in the operation theatre, wherein under a short general anesthesia, the foreign body can be removed if it can be seen outside. Sometimes X-rays and maybe even a CT scan needs to be done to localize and to know what kind of foreign body is there. But long and short of it, these foreign bodies which are long-standing need anesthesia for removal. So to conclude, foreign bodies in the ear are not very dangerous, so long as they are not sharp or they are animate, and they need to be removed so that they don't get infected and create problems later on. In cooperative children, they can be removed in the outpatient setting, but in uncooperative children, or if the foreign body is sharp or too deep, it needs anesthesia for removal. And so it is for nasal foreign bodies. Nasal foreign bodies are a little more emergent in terms of removal. One needs to remove it as early as possible, and hence presenting yourself to the hospital, getting it out in the outpatient setting is often what happens. Sometimes one needs to do X-rays, CT scan, and find out where the foreign body is, localize it, and remove it under general anesthesia in the operation theatre.